We're with Tim Pearce thanks to International Animal Health Products, and today we're talking about the vaccination of broodmares. Tim, why is it important that we vaccinate broodmares during pregnancy?
Well, there's a couple of reasons, Jane. Primarily, the reason to vaccinate any broodmare is to end up with a healthy foal. And there are a number of disease conditions which, if they're not vaccinated for, will compromise the foal when it's born. Some of the vaccines that we're using during pregnancy for mares is to deal with trying to stop abortions, such as in equine herpes abortions. The other things that we're using are things such as Salmonella, which can affect foals at birth, and Strangles and Tetanus. Those are the main ones. Most of those problems are problems of young animals and are primarily things that will be protected by getting the mare vaccinated during pregnancy. Some of that protection goes through from the immunity that's derived while it's in the animal, and some will be derived by drinking colostrum at birth. And of course, when they're born, it's a very, very important process for the broodmare owner or studmaster to make sure that the vaccinated mare's colostrum gets into the foal, and hence the immunity arises there. Herpes virus is a little different. Herpes causes abortions late in gestation. We've had a couple of fairly large outbreaks in New Zealand. It's worldwide a problem. It's less of a problem probably in a more extensive system in some of the owner breeders and things like that, but on big studs they're concerned about it, and so it is important that the mares get that vaccination protocol right and that they're done. Near the end of the herpes can cause abortions near the end of gestation and can also cause weak foals. So people are very, very aware of it, and breeders that remember having had foals like that make sure that it's part of their protocol every year. The vaccines are, generally speaking, they are all injectable. There are some exceptions with that. There are some. There is a Strangles vaccine that is given intranasally, but primarily the administration is via injection, and it's via an intramuscular injection. It's a pretty simple process.
Is it important for breeders out there to be vaccinating these mares during pregnancy?
I think it is, and I think it's got to be tempered with the fact that depending on how those horses are managed later on, I mean, you get a smaller breeder and some of those risks aren't as high, but on the bigger studs where there's a large pressure of numbers and there's travelling of horses coming and going, I think it certainly is an important part that you can reduce the risks of those diseases very significantly by vaccination. You know, we try and keep good records in our clinic histories, but you know, individual mare owners do need a copy of that sticker and what vaccine they got and what date, so that they can verify if they're going to a stud that it's actually being done.